There are three major causes that represent nearly 75% of causes of infertility. And these include either ovulation problem, egg production, which means, or sperm problems, or the passage that transports the sperm toward the egg and the fertilized egg back to the womb. And this was usually the tube, the fallopian tubes. Having problems with either of these three elements can lead to fertility in most of the times. Lack of ovulation, abnormal sperms, or abnormal fallopian tube. Firstly, identifying the cause. So we study the ovary, ovulation, we study the sperms, and we study the tubes. And we also can study other things like the womb and the cervix. And so there are two situations, one where we identify a problem, like in any of these three elements, or sometimes we don't find any problem, which is called unexplained infertility. So we correct ovulation, or deal with an abnormal sperm, or deal with the fallopian tube. And otherwise, if it is unexplained, we offer what we call insemination treatment or IVF. Available treatments include ovulation induction. So if there's lack of ovulation or problems with that, we give medications, usually initially tablets. Sometimes we give injections if the tablets don't work. These will be given on a cyclical basis to induce ovulation. So the woman would be able to produce an egg that can lead to a natural conception. Failing this, IUI, which is intrauterine insemination or artificial insemination, where the sperms are inserted inside the cavity of the womb. And the last resort is IVF, or test tube baby. Depending on the clinical assessment and the final diagnosis of each fertility case, we present them with some options of treatment. And patients can choose from these options. They cannot just choose what they like from what they have read online or social media, but it is a list of options that are available to them according to their diagnosis. If we need to induce ovulation, we can give them clomiphene citrate, which triggers ovulation, or another newer medicine called letrozole to do the same job. Then after this, they can have injections called the gonadotrophin injections or FSH injections, or finally, obviously, to go to IVF. In certain conditions, such as polycystic ovarian syndrome, we may offer them something called metformin, which improves insulin metabolism, or more recently, we use a drug called enofolic.